What is chlorpheniramine? Chlorpheniramine is an antihistamine medicine used to relieve symptoms of allergies. It belongs to the first-generation H1 antihistamines, which means it can cause drowsiness. 2. Uses of chlorpheniramine. Chlorpheniramine is commonly used for allergic rhinitis, runny nose, seasonal allergies, hay fever, sneezing and watery eyes, itchy nose and throat, skin allergies, urticaria/hives, common cold symptoms, in combination with other medicines. 3. Mechanism of action. How it works. Chlorpheniramine blocks H1 histamine receptors. Histamine is the chemical released during an allergy that causes symptoms like itching, sneezing, and a runny nose. By blocking histamine, it reduces allergic symptoms. 4. Dosage. General guide. Warning: dosage may vary. Always follow doctor instructions. Adults, 4 mg every 4 to 6 hours, maximum 24 mg per day. Children, 6-12 years, 2 mg every 4 to 6 hours. 2-6 years, 1 mg every 4 to 6 hours. Below 2 years, not recommended without doctor advice. 5. Side effects. Common side effects: drowsiness, dry mouth, dizziness, blurred vision, constipation, difficulty in urination. Rare, serious side effects: rare fast heartbeat, severe allergic reaction. 6. Contraindications. Who should avoid it? Avoid or use carefully if you have glaucoma, asthma attack, severe liver disease, enlarged prostate, urinary retention, taking sedatives or alcohol. 7. Drug interactions. Use caution with sleeping pills, alcohol, anxiety medicines, benzodiazepines, other antihistamines, antidepressants, MAO inhibitors. These can increase sedation. 8. Pregnancy and breastfeeding. Pregnancy, generally considered category B, relatively safe under doctor supervision. Breastfeeding, small amount passes in milk, may cause drowsiness in baby. Consult doctor. 9. Forms available: tablets, 2 mg, 4 mg, syrup, capsules, combination, cold and flu preparations. 10. Key points: works best for allergy symptoms, causes drowsiness, so avoid driving. Do not mix with alcohol. Not suitable for children under 2 years without medical supervision.